Hi everyone, welcome back. I'm Jin Su. Now let's learn how to administer an IV infusion. The first step is assessment. Assess the patient for any allergies. Check the expiration date before administering medication. Assess the appropriateness of the drug for the patient. Assess the compatibility of the ordered medication, diluent, and the infusing IV fluid. Review assessment and laboratory data that may influence drug administration. Verify patient name, dose, route, and time of administration. Assess the patient's knowledge about the medication. Provide the education for the patients. If the medication may affect the patient's vital signs, assess them before administration. Assess the IV insertion site, noting any swelling, coolness, leakage of fluid at site, redness, or pain. Now, let's watch the video to learn the implementing procedure of IV infusion. I would like to thank the team of the nurses in our affiliated cancer hospital for producing this teaching video. Welcome back. There are a range of complications that could occur during the IV infusion. Some of these complications can be prevented by the correct use of aseptic technique for insertion and maintenance, as well as assessing the device as indicated. Common complications are: first, infection. Skin-based bacteria may enter through insertion site. Local cellulitis or systemic bacteremia are possible. Second, phlebitis, vein irritation due to the presence of the catheter fluid or medication. Third, infiltration, leakage of fluids or medications into surrounding tissue. If infiltration occurs, nurses should immediately stop the infusion. Remove the catheter without placing pressure on the site. Elevate the affected limb. Apply either ice packs or warm compresses to the affected area, depending on the extravasated drug. Continue to assess and document the appearance of the site and associated signs and symptoms. Some signs, such as erythema and ulceration, may be delayed for 48 hours or more after the extravasation. Report to doctors. Invite medical team review the patient if necessary. Document the date and time of the infusion when extravasation was noted, the drug administered, the estimated amount of extravasated solution, and the administration technique used. Document the patient's signs and symptoms, treatment, and responses to treatment. Include the time you notified the patient's primary care provider and the primary care provider's name. In conclusion, using careful aseptic techniques, the nurse prepares the IV infusion, selects and prepares a venous site, disinfects the skin, inserts an IV catheter to initiate the infusion, and secures it in place, restraining joint motion near the insertion site as necessary. The amount of fluid to be infused per hour is calculated and the flow of prescribed fluid initiated at the desired flow rate. A pump or controller is typically used to ensure desired volume delivery. After initiating the infusion, the nurse ensures that the correct fluid is being administered at the assigned flow rate and observes the infusion site and the patient at least every hour for signs of infiltration or other complications. The site dressing should be observed and changed according to the guidelines of the hospital. Okay, that's all for the session. Thank you very much for joining us. Goodbye.